stands for pre-exposure prophylaxis for HIV. PrEP is really useful for people who may be at a higher risk of contracting HIV. So men who have sex with men, transgender women, or people whose partner is HIV positive and is in the early stages of treatment where they still have a detectable viral load. They may benefit from going on to PrEP. PrEP is an antiviral treatment which involves taking medication each day to protect against HIV. Studies across the world have been done and they have shown that it is around about 87% effective at reducing HIV transmission, and some studies have gone up as far as 96% effective if taken properly. By preventing the virus from being able to penetrate the cell walls. So if a virus cannot break into the cell to multiply and replicate, then it cannot survive. So it's an effective treatment for shutting the door in HIV's face. It starts to work very rapidly. When people start taking PrEP, usually within about 72 hours, they have effective cover. So we would advise when people start taking it that if they're having sex for the first couple of days to use condoms, but then after that it's safe to have sex without condoms. So if somebody's exposed to HIV while taking PrEP, as long as they're taking their PrEP as recommended, then their risk of HIV transmission is very, very low. Again, studies across the world have shown that there have been very few cases of people actually contracting HIV while taking PrEP. If somebody is exposed to HIV and they're not taking PrEP, then what they need to do is they need to get in touch with us or with A&E within 72 hours of sex occurring, and we can make a decision as to whether the risk of HIV is high enough that we need to put them onto what we call PrEP, which is post-exposure prophylaxis, which is then a combination of different drugs at a much higher level to try and reduce the risk of HIV being contracted when it may already be in the person's body. So there are two ways that people can take PrEP. They can either take it as a daily dose, which is where people take one tablet every day, around about the same time each day. That is 97.6% effective. The other option is what we call event-based dosing. This is for people who only are going to have sex at particular points where they can take PrEP the day before. They could take a double dose on that day and then take it for 2 to 3 days afterwards. So if they're having sex for a longer period, they need to continue taking each day until they have gone 72 hours after sex without any sexual contact, and then they can stop. The reason event-based dosing is less popular is because it doesn't give any flexibility around when people have sex. So you would need to plan ahead and know that you're having sex on Friday night, so you could start your treatment in advance and then stop it. It would not be effective if you suddenly hooked up with somebody and thought, actually, no, I want to have sex now. So daily dosing is what the vast majority of patients do. And they simply take that with some food, once a day, and it is effective. There is nothing to be gained from taking extra pills. It does not make it any more effective than taking the recommended dosage. All that will simply do is increase the side effects and potential risk of harm. Yeah, we've been using the drugs that make up PrEP for a number of years. These are antiviral drugs, so the side effects usually manifest within the first few days of taking them. The common side effects can be nausea, particularly if people take it on an empty stomach, which is why I always say take it after food. Sometimes it makes people feel very tired, so they may feel that they need to sleep. Or in other cases, it can make people have trouble sleeping. So I usually then say to patients, let's look at the time of day that you're taking it. If it's making you feel very tired after you take it, then let's switch to taking it at night. If it's giving you difficulty sleeping during the day, then I suggest we take it in the morning. And side effects usually settle down within the first week, and after that people are fine. Now, the things we need to be cautious about with PrEP are that it isn't suitable for everybody, so that if people have got severe liver damage or hepatitis B, we need to rethink about whether it's suitable for them, as the risk may be greater than the benefit. This would be a decision that would be made by the consultant if somebody wanted to go onto PrEP and we weren't sure that they were suitable. What we need to do with people who are on PrEP is we need to keep an eye on their blood, because it can affect the liver function. So, you know, if people are taking medication that can already damage their liver, or if they have a very high alcohol intake, we need to keep a close eye on them and check their liver function every time they come, in case PrEP is making it any worse. Now, I have dealt with over 150 people using PrEP in this area, and I've not had to stop any of them from taking it because of changes to their liver function. The other main thing we have to watch for is people who've got osteoporosis, because PrEP can slightly lower the bone density by about 2%. Now, for you and I, this would not be a significant number, but for somebody with osteoporosis, that could be enough just to make an already unpleasant situation far worse for them. So I always tell people, you know, if they're anxious about the reduction in bone density and they don't have a history of osteoporosis, then taking a multivitamin with some calcium will be enough to give them that protection. We naturally would lose calcium out of our bones as we get older, and after the age of 40 our bone density starts to naturally decrease very slowly. So, you know, 2% in a 40-year-old may not be significant, but in an 80-year-old it may be a significant difference, and that is something we would keep an eye on, again, with blood testing. It is a very, very safe drug, and we have had studies done across the world in a variety of situations, looking at men who have sex with men, heterosexual women who've got HIV positive partners, serodiscordant gay couples, to actually identify, are there any changes? And across the board we've got this 97.6% effectiveness rate, and we know long term, because these studies were done over a period of many years, that it is a safe drug. We know from using it to treat people with HIV that it is a very safe drug, and all of the medications that we use are strictly tested before they're being able to be licensed for the use. So we know that what we're getting is the right stuff, that it is going to do the job, and that's why it's safer to get the PrEP from either an NHS clinic or from a company like PrEPster, rather than ordering it off somewhere like eBay, where you don't know what you're getting, and it could be that you're actually buying a drug that is contaminated or isn't actually what you're purchasing. So if I had a male patient who has sex with men, which we call MSM, or if I had a transgender woman come in and they were having regular condomless anal sex, particularly if they're having multiple partners, or there is a risk, you know, of them contracting HIV because they're not actually having a relationship with one monogamous partner, then that would be a good idea for them to consider PrEP as a way of protecting them. Again, as I said previously, if we had a situation where somebody was newly diagnosed with HIV and they still had the virus showing in their body, we would then consider offering it to their partner to protect them from HIV transmission, while the HIV positive person goes on to treatment to bring the virus level in their body down to an undetectable point. Once somebody with HIV has an undetectable viral load, they cannot pass the virus on. So it would be then safe for them to have sex without a condom, as long as their viral load stays low and they're well, and live a normal life. It looks the same as life for anybody else. This is just a medication that we would take as a precaution once a day, much in the same way that women take a contraceptive pill as a precaution. So it doesn't stop you doing any normal activities or living a normal life. This just means that by taking it, you're reducing the risk of contracting HIV, and it's taking the fear and the worry of contracting HIV out of the equation. The rates for HIV in East Sussex are slightly higher than the national average. This may be due to our proximity to Brighton and to London, where levels are slightly higher. So we would consider that the risk of contracting HIV within East Sussex would be round about 1 in 10,000. So you can get information about PrEP online from the East Sussex Sexual Healthcare website. We also have information available through our Grindr use, and we are on most of the dating sites, so you'll find us on Tinder. We're also on Facebook, Instagram, YouTube, and covering all the forms of social media. We're getting more and more social media outputs by week really, so I'm sure we'll be on all of them fairly soon. You can also find information on the NHS website. You can find information on Terence Higgins Trust website, and you can also find information from PrEPster. You can access PrEP at sexual health clinics, so all you would need to do would be to phone up so that you were interested in PrEP, and then they would arrange for one of the health advising team, my team, to contact you. We would ask about your sexual history, your recent medical history, and make a decision as to whether PrEP would be a good idea for you. If that's the case, we would then make an appointment for you to come and see us, do some testing, have some blood tests, and we would start the ball rolling with some PrEP. Initially, we would give you 1 month's supply, and then we would see you in a month's time just to make sure that you're taking it properly, not having any side effects, and to answer any questions you've got. We would also be checking to make sure your vaccinations are up to date, and to answer any issues around safe sex that we had concerns about. So it's all confidential, it's all free, and we're really keen to see people, because this could be a game changer. You know, taking PrEP means that we've got a really good chance of actually reducing HIV transmission, and maybe one day actually eradicating it. So, I would encourage anyone who thinks that they might be eligible for PrEP to get in touch with us.